When you think about healthcare, you may not always think about shopping around for services.
Davonna Saier from Lexington Diagnostic Center is here to give us some tips what to do if your doctor says you need medical testing done. Very glad to have you in today.
Thanks for having
Important
me.
topic.
It is.
It really is, because, you know, oftentimes people, they say you need this diagnostic test or whatever, and you just go to wherever they sort of are nearby or what they recommend. But you do have a right to compare.
That's right. And I think what a lot of people don't realize, hospitals do a lot of things. They have a lot of services. And so there's a lot of overhead oftentimes incorporated in the cost. But there are diagnostic testing facilities and labs and other places that may be able to do it, and it's more affordable. People don't know, just like you shop for shoes, just like you shop for cars, you can shop for your health care costs and find what works best for your pocketbook.
Well, can't insurance, though, be a complicating factor? But just because it's paid for here, is it always paid for everywhere?
A lot of people say, I have insurance, it shouldn't matter where I go. And sometimes that is the truth, but oftentimes it's not. You've probably heard there's deductibles. There are higher deductibles in a lot of our plans right now. There are health savings accounts and flexible spending accounts, so patients are a lot more aware of what they're spending. And then also co-pays. Let's think about it. Co-pays are oftentimes a percentage. So if it's $3,000 here and $2,000 here and you're paying 10%, that is a difference. And I think a lot of people also don't realize insurance is like to save money. So not only should you call the place where you may be having your procedures done, but call the insurance. They're on your side and they should be able to tell you how much something's going to be as well.
So what would you tell any patient who you know, needs to have some diagnostic testing done for whatever reason? What should they think about?
So glad you asked. This is my biggest message that I tell patients every day as their advocate, and it is you have a choice where you go. And it's great to be compliant with your physician. You want to work with your healthcare provider and do what's best for you, but when it comes to any sort of testing outside a hospital, there are multiple places that can do it. Same images, same quality, same results for a much, much better price.
Davonna, give us some idea of the range of testing that you do there at the Lexington
So we do
radiology.
Okay, so MRI, CTs, ultrasound, nuclear medicine, and that sort of thing. And especially if you haven't met your deductible, MRIs can be as much as $1,000. Not all, but the complicated ones, if there's contrast or other certain things that you might need. We had a patient just last week that was going to pay over $500 at a community hospital for an ultrasound. It was $83 with us. Okay, we had somebody that was going to pay
a big difference.
Over $800 for an MRI. It was $420 with us. So always call around. And then another thing patients need to realize is there are oftentimes some other hidden charges. If a physician is involved, for example, a radiologist, our radiology fee is included in the price when it's quoted. But if you're shopping around, ask about those physician fees too.
All right.
Thanks for coming in.
Yes.
Appreciate it.
Thank you.